Welcome, Wolfpack students and families. My name is Mayorga. I'm a professor in the Department of Industrial and Systems Engineering here at NC State. And today is my pleasure to introduce Dr. Julie Ivy. She is a professor also in the Department of Industrial and Systems Engineering at NC State, and she's a Fitz Faculty Fellow. She directs the Health Systems Certificate Program. Her research interests are mathematical modeling applied to healthcare, public health, and humanitarian logistics, things that we might not think that math could be applied to. But what is great about this is that her research has made an impact on how researchers and practitioners address complex societal problems, such as health disparities, public health, preparedness, hunger relief, student performance, and personalized medicine. So Dr. Julie Ivy is here, and she will tell you a little bit about herself.
Oh, welcome to NC State Wolfpack family. Welcome to the family. Some of you might know a little bit about me from the article, but my name is Julie Ivy, as Maria said. I am originally from Detroit, Michigan. And in fact, I have been at NC State for about 13 years now. And my return to North Carolina is a little bit like returning home because my mom is actually from Salisbury, North Carolina. And so it's kind of like our family coming full circle. So I wanted to tell you a little bit about why I'm an industrial engineer. And many of you may not know what industrial and systems engineering is. Industrial and systems engineers, we look at how systems function, how people work. And I like to think of us as the most human-centered engineering. And for me, that's what attracted me, is I wanted to be able to use things that I liked. I liked math, and I wanted to be able to use it to think about how I could help people and ways that I could work with people and bring math and science together. And so that's what industrial engineering was for me. And so now when I think about the world, a lot of the way that I think about the world is driven by this quote by Emily Zimmerman and Stephen Wolf. And the quote says that health inequities are driven in large part by the social context in which people are born, live, and work. That is, the social policies that shape resources, institutions, and laws, and the economic system through which material and financial resources are created and distributed, and the social norms that govern those interactions. So when we think about people and we think about their life, we have to think about connections and systems. And so today, what we're going to talk about is taking a systems perspective on disparities at the intersection of health, wealth, and education.
Thanks, Dr. Ivy. You've used the word system a lot. And so for many of the incoming students, they may have used this word in other contexts. Can you explain further what you mean by a system?
Yes. So when I think about a system, one definition says it's basically this cohesive conglomeration of interrelated and interdependent parts, which can be natural or human-made. You might even think of it in the context of a network. So when we think about a network, one definition of a network is interconnected or interrelated chain, group, or system. So that might make you think about like a computer network or an electric grid. But another way that we also think about network, which is similar, is to think of it as something that is like informally interconnected group or association of people, such as friends, professional colleagues, et cetera. And so when we think about this system, we're thinking about the interconnection between groups and people. One way we can think about it is in terms of this figure. This figure is actually from psychology, and it represents, it's a social psychological model of health. And you think about it in terms of social determinants of health. I think Maria often refers to it as an onion. And so you can think about the onion, and at the center of that onion, we have health, wealth, and education. For us, that center, we think about that like your well-being. And so that those elements make the well-being of an individual. So we move that first layer of the onion. And then that individual is a function of the community in which they live. And that community in which they live influences their outcomes. And then the community in which they live is a function of the society in which they function. And so all those things come together to make the system.
Excellent. So now that we know what a system is, how can we apply systems thinking?
Okay, so when we think about systems thinking, we're going from this system and we're thinking about how can we take observations of events and data to identify patterns of behavior over time. And then based on those patterns of behavior that we see, can we move from that to these underlying structures that might drive those events or patterns that we see? So systems thinking thinks about how we're interconnected. It uses data and observations, what we see, to identify patterns of behavior over time, and then looks at, okay, what's causing those patterns? What are the structures or the systems in which we operate that drive the events and patterns that we see? And so if we think about that, one other way we can think about that, everything I keep talking about is this idea of connection or interconnection. So when I think about interconnection, we're thinking about this idea of mutual connection, two or more things that come together. And then we're thinking about this relationship between people, between a thing, between an idea, and its association with something else. So how are these things interrelated and connected? And so in the way that we think about health, wealth, and education, we want you to think about them in such a way that you can't think about one by itself and not consider the other. They're all related to each other. So if I think about an individual's health, by definition, their health and their health outcomes are influenced by their wealth or their lack of wealth. That might be influenced by their education. And all those things come together. If I think about education, it's influenced by the individual's health and their wealth, etc. And we're actually starting to see these things as we look at what's happening with COVID-19. So when we think about interconnections or think about these things as a system of systems, that implies that there's some level of shared inputs and outputs, and then interconnection and interconnecting processes.
You mentioned COVID-19, so let's take that a little bit further. If we were to try to apply systems thinking to COVID-19 and maybe the supply chain, how would you do that?
So let me start by asking you all a question. Since we've been on kind of lockdown through COVID-19, what was the most surprising grocery item that you could not find in stores during the pandemic? What surprised you? Now, for me, one of the things that was most surprising is I couldn't find this yeast. So when I sat at home and I'm like, oh, well, I'll be at home and I can't go out, I thought, well, let me bake. Because, and of course, when I come up with these ideas, I have this vision that I'm the only person who thinks of these things. And then I go to the store to discover that not only am I not the only person who thought of this thing, I wasn't even the first. And so now I am hoarding this single package of yeast that I've been able to find. What are some of the things that you all couldn't find?
So I'm sure that as the responses are coming in, some of the things that some people are going to think of is toilet paper, right? Because that was some of the most obvious. So we have some responses: toilet paper, soap.
Oh,
that was interesting. Flour.
Yes.
And I think that relates to your example
Yeast.
of the yeast. Everyone's
Yeah,
baking.
they go
Hand
hand in hand.
sanitizer. Yes. And that was
Yes.
one of the major ones. How many of you probably try to make your own hand sanitizer at home? And then I thought I was going to be very smart and make my own, and then all the ingredients to make the hand sanitizer. were gone, right? So people said water, bread, beans. Beans, that's an interesting
Okay.
one. Gloves,
Yeah, I've been
S
looking for
curl.
those.
Oh,
Oh, yeah, for
so
your hair.
for your hair, right? So there
Mm-hmm.
were different phases, right? In the beginning, we had the toilet paper and the hand sanitizer. And a few weeks in, when everybody needed to take care of their hair on their own, then you had like none of the razors and none of the shaving things were available. So very interesting. Yes, rubbing alcohol, that's because it's an ingredient for hand sanitizer.
I know. All of those
Uh,
things I've actually been looking for too.
so
So,
you want to
well,
dig deeper into why those things were missing?
yeah, let's think about why did this happen? So what drove the shortages? What are some of the key things that were uncertain that may have affected these shortages? So one thing for my example for yeast is that it turned out the demand for yeast increased over 300% from the demand from the previous year. So typically people use yeast, the holidays, Thanksgiving, maybe they use them in December, maybe in the spring, but essentially it's kind of a little flat demand curve. And so the production system wasn't even ready. What are some of the reasons that you think we had these shortages? What drove them?
Yeah. And what are the uncertainties associated with them as well, right? So some of
Yeah.
the, as we're thinking about why, I will tell you some of the other things that people found shortage of, and
Oh, yeah.
meat, I think that
Mm.
continues to be an issue. Sweatpants was one response, I
Okay,
think,
that's
because nobody
surprising.
wants to wear jeans at home, right? Or
Exactly.
work
We
clothes.
only dress from the top up, right? So,
Right. So, so why would it be, Dr. Ivy, what would be some of the things that would drive some of these shortages?
so let's think about the system, right? I gave you the example for yeast, right, where I thought I would be the only person who would be looking for yeast, but somehow the demand pattern actually changed. So what happened with respect to demand? We know that more people were at home, right? We know that people were looking for activities. What else happened? So demand is partly more people decided to bake, for example, or more people were searching for gloves. What's the other part of that demand that happened? I think one of the other things that we saw is that there was also this concern and people were buying from a panic perspective.
In fact,
And
one of the respondents just
yeah,
wrote that
hmm,
fear of the unknown caused by a lot of panic buying. So that's the
yes,
hoarding. And then
exactly.
someone had a good point. Um, they said the different supply chains. So, for example, the
Hmm.
restaurant versus the store. So, where do you consume the goods has shifted, right?
Yes. That's excellent point, right? So we're starting to identify a couple of things, uncertainties with respect to demand, with respect to where the demand was housed. So I don't know if many of you noticed that during this time period, restaurants had yeast, for example, like our local bakery would sell yeast. Many of them shifted to selling like their produce and other products that were becoming difficult to access in a grocery store because their demand also shifted and they had to think about different ways to address the shortage. People's uncertainty about how long this would last also affected their buying patterns and their hoarding. People's uncertainty about whether or not the supply or food would be available, whether it would run out, also triggered this kind of behavior. So then we're starting to get at some of the causes or the systems that affect it. One of them, that nice thing with the restaurant versus you eating at home, that's starting to look again like at this supply chain. So, what effect did the store shortages have on you? And what effect do you believe it had on others? So, for me, it's I couldn't bake bread. So, it was a little bit minor, right? I
So
had to
one
come
of the
up,
students mentioned shortages on masks. So that would
yeah,
probably have a very different effect than not being able to have baked bread at home, especially
exactly.
for the frontline workers, right?
Exactly. Exactly. And I think we're still seeing those shortages right now with respect to the mask. Although it's become a new market, right? So people are producing masks in many different ways. So one is we couldn't have our mask. what are other things? How did it affect you? And then how do you think it may have affected others?
Yeah,
So,
the loved ones or
mhm, your loved ones, people who may have fewer resources than you have, how might it have affected them? So, like,
someone mentioned
mhm,
cause stress and anxiety.
yeah,
So mental health, actually, we haven't discussed recently, but you showed in that picture
yeah,
about all of the different factors, and you have the personal factors and how that mental health could be tied to the fact that you're lacking something.
yeah, and the stress or concern about your ability to have access to that item. So,
One other response says big learning curve for priorities.
hmm.
Interesting.
That's very true. Kind of reflecting on those things that you actually need versus those things that you might want, how frequently you might need them. And so
Uh,
even,
Yeah.
go ahead.
Students are thinking so far ahead. I'm just reading the comments here. Deborah mentions that if you have lack of PPE and cleaning products, it could cause higher infection rates, which then is this a spiral effect because then you also have less of what you need. I'm sorry, Declan. That was Declan.
Declan.
Mhm.
Okay, Declan is a systems thinker, right? Because we're starting to think about how these systems interconnect and how it cascades, right? So your lack of
Right.
supply in one area is intimately connected to the other areas, right? So our inability to have masks, PPE, we've seen that happen in our health system, right? Where health workers have had to wear the same PPE over time, right? And then that influences the spread of disease and infection, both among the health workers as well as among people who they might encounter or be exposed to. And then we can see this interconnectedness, right? And how, if we just start thinking about the systems and which systems influence, how that kind of helps us start to shape, could we start to model or represent these relationships?
I
Right?
want to get in some of the other comments.
Okay.
Sham V says that people who depended on weekly or biweekly paychecks suddenly didn't have a safety net. And
Yes.
Nicholas says that this is where they start to see the connection with education, health, and
Mhm.
wealth, because people of different levels of all of those three would respond differently. So,
Exactly. Very true. Because one thing I think that I have thought a lot about is suppose you didn't, if you are leaving paycheck to paycheck, you may not have been able to stockpile or spend all of a sudden need to be able to buy extra food, right? And so then what context, consequence might that have had on you as well? Also, if we start to think about the supply chain, I want to talk a little bit about this connection between the for profit supply chain and the non-profit supply chain, and some things that we might have seen that are different, right? So if we think about the for-profit supply chain, those are like your stores, your Target, your Harris Teeter, Publix, those stores. If you see shortages in that area, what effect do you think that has on the nonprofit sectors? So like your food banks.
right, because now you have, like some people mentioned, some people without income who may be
Mm-hmm.
needing to find food, but the food bank may have been purchasing beans, for example, that somebody mentioned, and
Exactly.
now they're not there. Um, Someone mentioned a sense of security is impacted, Ashton.
Mm-hmm.
And
Mm-hmm.
Jared mentioned that there's also increased sense of anxiety related to protecting your loved ones, especially if they're elderly.
Yep.
And that echoes Chase also mentioned freaking out, meaning it that then you become desperate and it
Mm-hmm.
causes you to get more of the things or
Yeah.
feel like you really need more toilet paper, even though
Mm-hmm.
you're probably okay.
Exactly, getting up to the limit. So then we saw the for profit supply chain start to institute limits, right, or constraints in order to spread what they had to as many people as possible. In the nonprofit supply chain, food banks for example, receive their food from many sources. And some of them are federal, right? So they might get food from the federal government. The Emergency Food Assistance Program provides food. They receive food from state sources. They receive food from donors like us. So maybe if you've had a food drive at your school or with an organization, that's one of the sources. Another major source is from the for-profit industry that donates what is surplus that is in that industry. So like if Walmart has excess, they have a very large relationship and partnership with Feeding America where they donate that excess. Food Lion does the same thing with the Food Bank of Central and Eastern North Carolina. So what we start to see in terms of these systems connecting is that when the for-profit sector is constrained in terms of supply available, that then also has an effect on the nonprofit sector, which can influence the ability of a food bank to distribute food to people in need. Are there
Declan
other?
mentions that maybe the food banks won't be able to stay open. But if we think about the consequences of the food bank not being open versus a restaurant not being open, can you speak a little bit about that?
Yes. So, actually, there was some concern by food banks about their supply. And so, one of the things that we do is we've worked with Food Bank of Central and Eastern North Carolina for a long time. Actually, I don't know, 8 years now, looking at their supply chain and helping them understand demand, where demand is, and then sources of supply. So one of the things that the food banks have been doing to supplement their demand is, first of all, they partner with farms. And so some of the produce and some of the meat products actually that weren't being sold in stores at the same rate, or those that were excess, they were gleaned from farms and gleaned from the meat industry and then went into the nonprofit supply chain. The CARES Act actually infused federal food into the food bank supply chain. And then also some of the rules associated with qualifying for the federal food were relaxed to some degree to enable more people who had need to be able to receive the food. The other thing, if we think about the food bank, I talked a lot about the sources of food. Some of the other things that help it run have to do with the volunteers. So food banks, they have like kind of a skeleton staff, but they rely heavily on volunteers. Where do you think volunteers come from in the food bank? So if you're in a college town, like so when NC State's in session, there are a lot of students who serve at the Food Bank of Central and Eastern North Carolina and volunteer, and they sort the food and they check for safety and they package it for families. Another huge source of their volunteer workforce are people who are retired, because a lot of retired people spend a lot of time giving back. And so one of the ways they do that is with the food bank. So when we looked at COVID-19, one of the things that happened is those who are of retirement age, which I'll say is a little older, were also part of the high-risk population. So not only did you have these strains on the supply chain in terms of the availability of food and trying to replace that food that was no longer coming in at the same rate from the for-profit, we also had a constraint in terms of our ability to process the food because the number of volunteers got constrained and they didn't want to cause anyone to, acquire COVID because they were volunteering. So
It's funny how when you start to dig deep, you see really how complex the problem is. Another student, Priscilla, mentioned that maybe they have to be more cautious with donations coming from the public to make sure that they're safe. So
yes.
I think we understand how complex a problem can be and maybe what systems thinking is and really teasing things apart. So, but what can we do about it, right?
Exactly.
Engineers, we want to fix things. So
And
how
solve
can we
problems.
solve these problems?
Okay. So one of the things that we do is we look at data. And in particular, we look at the food banks data and we look at their patterns and trends. So we look at where they get their supply from, where they have volunteers, when supply comes in, how many volunteers they need. And so using that information, we can help them make choices and decisions and say, we know there's going to be constraint in terms of the food donations and also making them safe. So one of the things they did was they shifted to pursuing more monetary donations, so then they could control the quality of the food that came in and also the safety of it, right? So then they could control the buying patterns. And a lot of people shifted towards monetary donations. In terms of the volunteers, well, they knew they needed the volunteer workforce. So what they were able to do is, based on knowing kind of what their volunteer needs are, they were able to reach out actually to the federal government, and the National Guard has actually been providing significant assistance and helping them distribute food to people in need and kind of taking the space of those volunteers. And then as we've been opening up a little bit more, what they've done is they've defined specific hours for volunteers and they regulate how many volunteers can come in. So it is actually still possible for you to volunteer and work with them. So one of the things that we're able to do, kind of looking at this as engineers and going through this kind of complex process of what are the systems? How do the systems interact? What data or information do we have about the systems? We can kind of target priorities. We can target where there might be weak spots in the system. One thing that we called kind of a weak spot is we looked at counties where there seemed to be like constraints in their ability to receive food. And so we helped the food bank look and say, well, okay, this county doesn't seem to be getting what it needs. So can we add more agencies there, food pantries, shelters, soup kitchens, so that they can increase their distribution ability? So the exciting thing is that there's lots of ways for us as engineers to help them, more than simply sorting food, but really helping them to process all of this data that they have and helping them make choices and helping them make better choices.
I think I have a little picture of you at the food bank, and I'll share that. And while I share that, can you explain what you mean by a better choice? How do you know it's a good decision? If I was a company, I know I'm trying to maximize profit, but as the food bank, well, how did you know you were making a good choice?
So for the food bank, their choices are a little bit different. You're right. Like in the for-profit supply chain, almost as the name implies, the goal is really that we're trying to maximize profit. We have a good sense of demand. For the food bank, what they look at is equity. And equity, they think of it in terms of is everyone getting their fair share? So if you think about the demand, we have this demand that unfortunately is significantly higher than the supply. But what they want to do is make sure as many people as possible get something. So rather than trying to simply satisfy everyone's demand, because that's very difficult, they want to make sure that everyone gets what they call is their fair share. So are you getting basically your piece of the pie so that we can give out food to as many people as possible? So for them, that's one of the ways that they define a good decision. You can think of it as their objective. The other way that they define a good decision is they don't want to waste food. Like they work really, really hard to turn their inventory and get it out. Like whatever comes in, they try to process it as quickly as possible so that it won't spoil or go bad, and get it out to as many people as possible, as quickly as possible, so there's no waste. And then the third thing that they think about is, can I get the food out in a way that I kind of minimize the resources or the cost associated with doing that? And so we like to think of that as being efficient. But in their priority order, it's like equity, being effective, minimizing waste, and then efficient.
Thank you. I love that we can apply our engineering problems to solve these humanitarian issues and health issues. I think we're getting close to the end, and I'm glad you shared that success story with us. Do you have any parting words for the students? Any parting thoughts?
I guess the one thing I encourage you to do is to kind of realize all the things that you bring to the table. I use the example with the food bank is, most people go to the food bank and they sort food, which is great and helpful, but like we're engineers, we're scientists, we're college students. There's a lot we can do to help. And so this idea, and it's kind of the theme of NC State is this think and do, that not only do we want to think about these grand challenges, but we really want to work to figure out what can we do? How can we use our skills to make an impact and make a difference? And the exciting thing is that you guys have so much to offer, and there are all of these places that are around that need your skills. And so as you think about things as a system, with your system thinking, as you think about how people make decisions and you make sure to incorporate the fact that there's uncertainty there, and then as you try to understand what makes a good decision, and that good can be defined in so many ways, your approach to the world and the way that you can help is almost limitless. So I really just want to welcome you to NC State. I'm excited to have you. And you might have noticed in the picture that this work requires partnership with the food bank, but also partnership with students. We work a lot with students. We love to have students work with us in research. And so there are many opportunities for you to engage in lots of different projects with different faculty and different research teams to help.
Thank you, Dr. Ivy, and thank you all for joining us today. That brings us to the end, and we look forward to seeing you in the coming months.
Yeah, welcome to NC State.
Go Pack.
Go Pack.